What we're doing today is a lumbar medial branch block. This patient has a lot of low back pain. She has a lot of arthritis on her MRI. So what we're doing is we're testing to see if her lower back pain is indeed coming from the arthritis in the joints of the back.
So when you're seeing someone in the office, what's a good way to know that their pain is coming from the arthritis? A herniated disc or a pinched nerve or something like that? Like how can a patient know?
Good question. Well, first off, the patient tells us, what their symptoms are. So if a patient has pain that is in the back, but then it radiates down her lower back, then I'm thinking that she might actually have a pinched nerve. This patient in particular only has lower back pain. It's a combination of the pain that she's feeling plus the symptoms that she has. So she has lower back pain. The pain is only localized to the lower back. It's worse when she's standing or when she's extending her back, because when you extend your back, you put pressure on the joints. So she had symptoms of lower back pain, in addition to pain with prolonged sitting or standing, pain when she's extending her back. And then to confirm it, we did an MRI, and the MRI showed that she had facet arthrosis, which is just a fancy word for arthritis in the joints of the back.
And now you said that this was a way to diagnose it as the cause of the pain.
Exactly.
So how long can someone expect to get relief after something like this?
This is just a short-term diagnostic block, right? So all I'm injecting is essentially bupivacaine, which is a little bit longer lasting version of lidocaine. If she feels relief, even if it's for a few hours or a day or so, that's a successful block. Her pain should probably end up coming back anyway. Sometimes patients feel pain relief for a little bit longer, but that's because we're breaking the pain cycle. They're able to kind of finally feel some relief. And some people even feel a little bit of an increase in their pain once the lidocaine wears off, because they finally feel relief in their lower back.
So if someone does have some pain relief, but it's only temporary, what would you do after this?
So this is medial branch block number 1,
okay.
AKA diagnostic block number 1.
Okay.
So if she feels relief, for 2 reasons: 1, for insurance purposes, and 2, to actually convince ourselves that this is indeed what's causing her pain.
Does anything change on the second block? Like are the needles still in the same spot? Are the medications all the same?
Good question. The second block is pretty much exactly identical with the exception of the anesthetic.
Okay.
So we use a different numbing medicine when we do the second block.
Okay. So basically proving that the first time wasn't a fluke.
Exactly.
And then let's say the person's happy after both blocks. What's next? A third block?
Now that we confirmed twice that this is what's indeed causing this patient pain, what we do is we proceed to the ablation, which is a radio frequency ablation.
Okay, what's that mean?
And that pretty much essentially means that we're going to burn the nerves in that same location that we blocked it twice. And by burning, I mean we use that machine over there.
I'm familiar.
Oh, okay.